in the field, he's considered Doc because he would be that guy. He would be that provider, that only medic that's out there at times.
Originally, I'm from the Caribbean, Trinidad and Tobago. I moved here at the age of 19. I enlisted in the Army in 2012. Became a 68 Whiskey combat medic or a healthcare specialist.
When I first met Specialist Joseph, he came in very quiet. He was very willing and open to new things. So although he had a lot of knowledge about his job and his career field, he came in with open arms and open mind as well.
I went to college. My major was engineering science. The Army wasn't my first choice, but I transferred schools and I just incurred like a huge bill and, I couldn't afford to pay it. So I was like, now what?
When we have new soldiers that come into Andrew Rader U.S. Army Health Clinic, we usually pretty much have an idea of what type of soldier we have coming in based off their MOS. As far as placement, we actually strategically place them throughout the clinic to make sure that they are able to provide the best health care possible to our patients. We also have formal training based off the need of the soldier. So once the soldier gets here and we learn what he or she has not actually had competencies in, we'll actually go ahead and build our training schedule based off of that.
I had a few options when I enlisted, and the other options weren't really, I didn't really find any interest in it. So the healthcare field was the only thing that, it's like I can actually use this if and when I decide to get out. Initially in AIT, it's difficult because you're squeezing extended course into about 7 weeks as an EMT, and you still gotta incorporate PT, you still gotta do your regular soldier duties. The EMT phase and the whiskey phase is different. The whiskey phase is more tailored to combat. So, it's dealing with combat casualties, whereas EMT is dealing with the civilian side.
Healthcare for military is actually like almost two-sided. So we have our TO&E side and our TDA side. Our TO&E side is pretty much like on the force comm side, combat arms, things of that nature. So it's a little different mindset, and the abilities of our medics and other supporting staff that come in may vary based off of what they are allowed to do. For instance, when they're deployed, they're allowed to do a lot more in the field than they are when they come into a fixed facility like we are.
I work with optometry, podiatry, and well women also. You gotta be well-rounded. I think it's good for every soldier to have both sides. My intention is definitely to go back to college, trying to become a PA eventually. It gives information about going back to college for soldiers. We have TA assistance, tuition assistance. So basically it helps with tuition for college and stuff.
The advice I would give, just stay focused, stay goal-oriented, and know that the road is not always rough, because there are going to be some rough spots. And we've endured some different challenges throughout our healthcare careers, but just know that you can get over it and don't give up.
Keep an open mind, definitely, because my intention, coming into the Army, definitely wasn't healthcare. And right now, there isn't anything else I would rather be doing than this.